And I call the member for Hasluck.
Thank you, Deputy Speaker. It's good to have the opportunity of rising to speak on the Health and Ageing, the House of Representatives Standing Committee on Health and Ageing Lost in the Labyrinth report, which was an inquiry into the registration processes and the support for overseas trained doctors. This report is an interesting report because it reflects the complex nature of the accreditation and registration processes and the breadth of issues faced by international medical graduates in their personal and professional lives. And each individual who gave evidence brought a different perspective to some of the challenges that they themselves experienced in this total process from the time of leaving their country of origin to arriving in Australia and then being appointed to a region somewhere within Australia. I found the evidence provided by the committee both interesting and vexing. The ongoing challenges of not being considered problematic, the patterns of access and reasons for failure would to me have seemed obviously evident, but it didn't appear to be when we question those who are responsible for those processes when they appeared before us. Whilst things have improved, I hope that this report streamlines the way in which IMGs are recognised for their qualifications, their capabilities and capacities, and meet the registration requirements. I think the Commonwealth Government agencies need to better coordinate the service they provide and not assume that all is fine in respect to IMGs, who provide an invaluable service to regional and rural Australia. The other element that I found interesting was the complexity of the issues facing individuals and the way in which they had to fundamentally at times go it alone in challenging some of the considerations, both by the professional colleges, but certainly by government agencies, and then chasing paperwork and the problematic issues of acquiring additional paperwork from their country and university of origin. Australia has one of the best health systems in the world, delivering high-quality healthcare to the community, and the work of the committee reflects the need to ensure that the status quo is maintained. At no stage did we ever want a reduction in the standard that is provided. In fact, one hearing we were at in Cairns, 3 witnesses left and they made a comment about the committee's inquiry and the details that we were seeking. One of them suggested that we were trying to lower the bar, but at no stage did we ever contemplate that. We have an obligation to ensure that the highest quality of care is provided across this country. The committee does not support any reduction in the high clinical standards expected of our medical practitioners. Australia is reliant on IMGs to address medical practitioner workforce shortages, particularly in the regional, rural and remote communities, where they make up over 40% of the medical workforce. In some jurisdictions it was slightly higher, but on average it is around that level. IMGs indicated in both the 22 public hearings and the 216 submissions received by the committee that they, in their view, do not always receive the same level of support from the institutions and agencies that they interact with. The aim of the committee's work was to reduce red tape, duplication, the administrative hurdles faced by IMGs, whilst ensuring that Australian standards continue to be rigorously applied. Experiences ranged from those who had difficulties meeting the new mandatory registration standards, particularly standards pertaining to English language proficiency, and at one stage one shared the story of they failed because they weren't able to express what an Australian colloquial saying was, which I found very interesting to have included. Another failed because they were asked, when an Aboriginal grandmother brought a child for medical treatment, they were asked what was the first question you should ask the patient. And he responded by saying about the condition of the child, but was then chastised for not saying where is the mother, and on that basis did not pass that test. The transcripts, if you get the opportunity of reading them, are well worth looking at some of the challenges experienced by highly credentialed people who came and who, through a 10-year period, served time in rural and remote Australia. Let me also say that the response from the Medical Board of Australia, the Australian Health Practitioners Registration Agency and the AMA, and the Australian Medical Council was constructive and positive. And in fact, when I've met with some of them after we released the report, they were very complimentary in the way in which the committee looked at the issues but gave recommended actions that were pragmatic, that they could take responsibility for and implement. We were also ensuring that the supporting documentation that is often a challenge in presenting it to multiple points of registration or multiple points of examination became easier with one central depository to which they could go back to. We also, in the report, covered the issue of developing a cohesive and comprehensive system of ongoing support for IMGs and their families, with a particular emphasis on the educational needs of their children, along with support and employment prospects for the spouses. The committee recommended that Health Workforce Australia, in consultation with key stakeholders, develop a nationally consistent and streamlined system of education and training support for international medical placements and for the graduates. But the thing that puzzled me in all of this, and it still does to some extent, and I hope that we do address it, is that it demonstrated to me that our workforce planning for our populations is not our strength as a nation. That if the population projection for the next decade takes us, say, from 22.5 million to 27 million, then why aren't we forward planning the number of doctors, allied health professionals that we need and making available those places within a university? It makes logical sense. I also don't want to see us plunder other nations for their medical practitioners, because we leave a deficit within their healthcare systems, and certainly I would rather see us have that as a strength. The number of medical schools need to be seriously considered given the time required for doctors to be trained before they become a general practitioner. And by this I mean we assume that a 6-year training degree automatically puts a doctor into situ where they practice, but in fact it takes 13 years before they are able to practice on their own. So our time lag is significant. I'm aware that Curtin University is seeking to establish a School of Medicine to increase the number of doctors for Western Australia and ultimately Australia, and I hope that in the future they are supported in that endeavour. I think the other thing that really struck me was the absolute neglect that we have of rural, remote and regional Australia. Time and time again we heard of IMGs, ageing workforce, and some of the challenges in getting people out into regional, rural and remote Australia. So we have this requirement for those on 457 visas to spend a period of 10 years in regional Australia, but under some circumstances they can return to a capital city, but they have to be mitigating. It's a time that all persuasions of governments at all levels gave serious consideration to health services in rural Australia and the models of care that are provided. When we consider what is in this report, I think this report should be read by every member of this Parliament because it contains a good synopsis of the challenges we face for the health workforce of our health system, and therefore, in that sense, position ourselves to be much more strategic in the training and skilling of people. I would hate to see in 10 years' time we have this lack of numbers to fulfil the needs of fellow Australians. I think the other thing that's also important in this report is those who contribute to the skilling, the professional level and to the quality healthcare system that we enjoy and take for granted. And on that basis, I certainly, from a committee membership basis, commend the report for broader reading and certainly for support in respect to the recommendations, because if they are adopted and taken up, then we will see an incredible growth in the number of professionals that service this country. We will see the maintenance of a standard and quality of health care that we take for granted. Thank you, Mr Deputy Speaker.